Dr. Usha R. She is going to present vision Salvage in retinoblastoma in 10-year clinical review. Dr. Usha, please.
Retinoblastoma is the most common primary primitive neuroectodermal intraocular malignancy, incidence being about 1 in 15,000 live births. Advances in the treatment has changed the outcome for retinoblastoma, improving both the vision and long-term survival. If the tumor is confined to the globe with multimodal treatment strategies, 90% of the children survive with preservation of vision in at least one eye, even in bilateral retinoblastoma. High-dose chemotherapy, salvage chemotherapy, and intravitreal melphalan have almost replaced radiation. Following the life, globe and vision salvage has been a major objective. Visual outcome in retinoblastoma is attributed majorly to the tumor location within the retina, mostly the macular involvement. We retrospectively reviewed the retinoblastoma case files to see the outcome of vision in deceased salvaged eyes and also to predict the factors impacting the visual outcome. So all children diagnosed with retinoblastoma in the Ocular Oncology Unit, Arvind Eye Hospital, Madurai, from January 2004 to December 2024 were reviewed, and the inclusion criteria were children with disease-free and provided the last clinical follow-up till January 2025. Exclusion were children who underwent enucleation, children lost to follow-up, treatment defaulter, died during treatment, and follow-up. So from 2004 to 24, 823 patients registered, all initiated on treatment in-house, 649 completed treatment and are under follow-up, 71 defaulted and 103 died. The range of age of presentation was from birth to 60 months of age. Of these 649 children who completed the treatment and are under follow-up, 226 patients were treated without enucleation, of which males were 97 and females were 129. Unilateral were 17 patients. Bilateral were 209 patients, of which one eye was salvaged. Among the bilateral patients, 23 had both eyes salvaged. In total, 252 eyes of 226 patients were analyzed for the visual outcome. So there were 84 in Group A, 66 in Group B, 56 in Group C, 27 in Group D, and 19 in Group E. There were various modalities of treatment which ranged from VEC alone or VEC plus CSA, VEC plus CSA with local therapies like TTT, cryo, VEC plus CSA plus radiation, VEC plus CSA plus intra-arterial chemotherapy, and only TTT for some small lesions like Group A. So about 70% of the patients had chemotherapy, 24% had VEC with CSA, and there were a 6% without chemotherapy. The tumor location, total patients were 226. RB with macula and disc involvement were 87. RB elsewhere was 139. So the vision improvement ranged from 6.6. 121 patients had 6.6 vision, 24 with 6.9, 23 with 6.12 to 6.18. 20 with 624 to 636. There were a few with light perception and hand movements. Now I'll quote a few examples. 8-month-old female with bilateral retinoblastoma, group right eye group E, left eye group D, right eye post enucleation. There were several sittings of chemotherapy, intravitreal and IV. Left eye had showed a regressed RB and the vision was 624. This is in a bilateral, one eye was salvaged. Both eye vision salvage and bilateral RB. 3 months male, premature baby, came for ROP screening. Right eye showed group B, left eye showed group A. There were multiple sittings of chemotherapy and TTT given. Genetic testing showed a de novo germline mutation. Vision both eyes affixing and following. Patient is on regular follow-up. Vision salvage and unilateral RB as well. 7-month-old female presented with a child. The father had, there's a family history of RB. So they came for a routine screening. Right eye showed group B RB and the genetic testing showed no mutation. Vision in the right eye was 636 and left eye was 66. Now, here is another patient where the mother of the patient had retinoblastoma bilaterally enucleated at the age of 3 years. Patient was 9 months old and right eye showed group C, left eye showed group E. Genetic testing showed a splice site mutation and the vision in both eyes were right eye 6.6 partial and left eye 6.9. So good visual outcome by early detection of RB. Father had enucleated right eye due to retinoblastoma at the age of 2 years. So a routine screening was done for this particular patient who had a group A suspected RB. Left eye also had a group A. So patient underwent treatment, and a genetic report was also.
Thanks a lot.
Thank you very much.
I just have one question.
Yes, sir.
Why did you choose Community of Health to put up this paper?
So the implications are multifold.
It is not mentioned here.
The
The choice is because it looks very odd. It has no link with the Community
So,
of Health kind of.
if
It is not a survey. You are showing the cases, this thing.
So
So I am little confused.
yes, I will explain.
No, thanks. Thank you very much.